workers less accessible. It gave workers an easy out from engaging clients because it narrowed the ways in which clients or applicants interact with workers. And I've done this work, or I've done this work collaboratively from the applicant or the beneficiary's view. Any questions so far? No? So now, because again, I mentioned we were doing interviews with workers, we're shifting our perspective. So we're trying to examine how COVID impacted frontline workers. In doing so, we're hoping to contribute to the street level bureaucracy body of research and amend in different ways the administrative burden research, thinking more carefully about who's imposed upon by onerous experiences of the state. Can we think about workers as experiencing administrative burden? Is that a distinct phenomenon in and of itself? Does it represent something else in the public administration literature? Sort of thinking through that. So we typically have developed our understanding of street level bureaucracy during ordinary times. So what's the routine complications that workers are going to experience day to day? What kinds of pressures are they going to experience? How are they responding to policy changes that are relatively in the realm of normal, right? We don't really think about what happens when crisis disrupts practices and routines. Crisis, and in the case of the pandemic, it can create new institutional and organizational landscape and governance structures that we need to think about. And we have some empirical evidence about COVID in the front lines that points to some policy ambiguity. So people just didn't know what to do. And I don't think any of us knew what to do, but bureaucrats especially didn't know what to do. Rapid communication. So in addition to confusing policy, getting rapid communication about policy changes in real time, that complicated street level bureaucracy. Greater discretion. So folks are making decisions on the fly. Frontline workers are making decisions on the fly on how to meet people's needs. Incredible resource constraints. And we'll see a little bit of that in a second with some of the data. What happens when demand for services skyrocket and you have a small agency? What do you do then? Emotional labor. What happens when your clients are facing needs you've never seen before? Or, and I did some adult Medicaid interviews, your clients are dying because they're infected or they've succumbed to COVID. What do you do then? What kind of emotional labor are you engaging in with beneficiaries and their families? And then burnout, just caving to the pressures of all of these different things, right? Experiencing burnout and not feeling supported by the agency because you're in this time of crisis. So we know this from the developing space, the developing world, the developing context. We don't actually have a lot on what was going on in safety net programs in the US. So that's sort of the job of myself and the research team. Any questions? No? That was good. So the research question, the bigger research question is, how did bureaucrats experience COVID policy changes in WIC, SNAP, and Medicaid? And I'm going to show you a snippet of the data, so 34 phone interviews from April to September of 2020. So this is as soon as the pandemic starts, the immediate adjustments that workers are making and in WIC, SNAP, and Medicaid across 4 counties in North Carolina. I'm taking an interpretive approach, and interpretive approach as defined by a couple of scholars in public administration that combines inductive and deductive analysis. Meaning I am acknowledging theories from the past and current paradigms to inform the way that I think about the data, but I'm also very flexible and open to emergent themes. And the goal of this research is to develop a thick, rich description of how bureaucrats are responding to COVID, and hopefully aid conceptual development. It is an iterative process, which is why this is more of an open-ended conversation. I'm like, oh, I've not said much yet. It's not like a one-sided conversation. So I encourage input and your own reflections about the data. Sure.
I actually so the bureaucrats, are there in North Carolina, like the same office be dealing with WIC, SNAP, and Medicaid, or is there distinct agents working on each of those programs?
So WIC is delivered through the public health system in North Carolina, which consists of a mix of county health departments, and in some cases, a split between county health departments and community health centers. And then SNAP and Medicaid are delivered through county departments.
Okay.
Yes.
When you say bureaucrats, are you talking about kind of is that sort of a vertical from like case managers up to agency leaders, or are you looking like, how are you defining bureaucrat in this
So
space?
bureaucrats consist of frontline workers, so your rank and file eligibility worker that would be taking in an application, and supervisors of duties.
So really the street level.
Yeah, it's very street level. Yes.
Could you speak more to the 4 counties that the bureaucrats came from? Were there like lots of people using these programs in those counties? Were they all different types of counties, all the same type?
So it's a mix of urban, suburban, and rural. And all 4 counties experience an increase in demand. So most states experience an increase in demand for assistance programs. But these counties especially.
I want to ask you about the administrative exclusion. So in terms of the administrative exclusion, is it part of the reason that, labor policies were expanded, but the information wasn't conveyed to recipient?
Yes.
So, how does it different that the conveyance of information through digital platforms or outreach efforts through normal times and during times of the crisis? So when the policy updates, so is there any difference in terms of additional outreach efforts? And one more question. Part of the reason could be increased caseload and using remote appointments, because my research showed that people were complaining for not being able to reach a human.
Yep.
So,
Yep.
and then there is proposals, and actually Ohio State start using chatbots for, some administrative agencies. So do you think using chatbots or virtual people help us in the, or, make, in terms of, it seems like a great, way of conveying information, making more circumstances responsive in theory, but are there any problems with the, in terms of, making?
So the first question, what is administrative exclusion? It's organizational practices that exclude, organizational practices or routines that exclude people who should be eligible for state programs. How much of that is related to some of the outcomes that we find early on in the papers that I mentioned? A lot. So that's the argument, the overarching argument for the, I was an argument, but objective, right? For the bigger study is understanding the extent to which administrative components upended or undermined these major COVID policy changes that should have done more, I think, for families and precarity. And then in terms of technology, that's funny and fickle. So technology matters when you have a worker that can staff that chat stuff and answer questions. And it also, the degree to which technology matters depends on how salient it is to the beneficiary of the applicant. And that often depends on age. So for example, I have an online SNAP purchasing project where we're basically asking people preferences around that. If they use it, why they don't use it, what they would do instead. And a lot of folks just don't like engaging in that way, in part because it's an additional variable that stands between their materials, the compliance costs they've already borne through the documents they've gathered, and the person who makes the decision. So they like proximity to that person. They want to be able to hand in their paperwork. This is just overall my journal impressions of all the data that I've ever collected. That sounds like a big sort of forthright statement, but people really prefer being able to hand something to someone and have that decision made. Because otherwise, when you introduce all these different variables, whether it's an email, it's an e-application, sometimes it's not clear to them the how their documents how their information gets lost in that process or where it goes. And then there was,
Well, I'm wondering whether I really have a question, actually. When you mentioned policy ambiguity, in a way, I can see for WIC and SNAP that there's ambiguity, how do we apply, right? But in general, COVID disrupted pretty much everything.
It did.
And not just those two groups of beneficiaries. And I was thinking back, I wish I could go to the past and interview people. I think it's really cool that you managed to get a hold of 34 people as they experienced the change, because if I think back of the 1880s, which is a few years before I was born, local administrators faced monumental challenges as a function of social economic changes, moving from an agrarian to an industrial society. I'm beginning to wonder now, all the literature that I know, there's hardly any mention of how they cope with it. Only in retrospect, they actually cope with it. How? So I have that question now, thanks to you.
oh, okay, well. Thank you, I've done my job. Top ended. Yes. Oh, did I miss anyone over here?
I just had a quick question. You already started to respond to Stephanie's question about this, but could you give an example of like some of the bureaucrats that you sort of talked to as part of this group? And then just from a curiosity standpoint, from a methodological perspective, what was the process of gaining access?
Yeah. So okay. So WIC offices are relatively small. North Carolina is 80% rural. I'm interested in variation across community contexts. So it is the case that I could interview whole units of WIC offices. So a WIC office that has a caseload of maybe 3,000 people could be 5 folks. It could be a director who serves as what's called a vendor coordinator, goes out and checks and sees whether stores are acting right. And then it could be a processing clerk that issues the vouchers and does the initial intake process. And then 2 or 3 nutritionists that are talking WIC participants through the food package and assessing nutritional risk and need. With the Department of Social Services, there's a lot more variation across counties and how big those units are. So in a rural county, a SNAP unit could be 20 people. And that could include the supervisor and the lead worker. It could include, sometimes you'll see this in a second, because of federalism, states and counties have a lot of discretion in how they organize their units. So it could be that there's 10 people that do SNAP applications, 10 people that do recertifications, a fraud worker, a lead worker that's supervising both, and then a unit supervisor. I tried to capture a range of perspectives in the data, and that's for this data that I'm presenting today, and then the data that's collected in other states. And then in terms of access, I always say the quality of your data is only as good as your relationships. So this was a long game. I started getting to know places, visiting counties and offices in 2015. So I was well into the field and had already had these relationships with county administrators and the state prior to the pandemic. So the question they were interested in was, why aren't people staying on these programs? They had a problem with WIC retention in particular, and I was helping the state understand that and understanding county level variation in performance. So some counties are really good at delivering SNAP, terrible delivering Medicaid or vice versa. And they wanted to understand. So I was already in the field with these relationships. And then, was there a question? Just one more and then I'll move on.
Okay, one
Thank
one follow-up, and you might get into this is, I know I work a lot in like with workforce and in the unemployment insurance space in that time. They basically any human in the agency was pressed into that. Do most of these people that you interview have prior experience with the program, or were they being pulled in from other areas to help triage?
So
during
there
this time?
were role changes, and you'll see some examples of that. I suspect, and I guess I'll get to this a little later, that there is a lot of variation across states and how they use the workforce to meet these demands. Findings. Here's a preview. So there is unprecedented demand. Surprise, surprise. So workers across all 3 programs reported increased applications. I remember maybe like a month in, or no, probably like end of March, I called, so I've been doing some work in the largest urban county. And I called the director and I asked, what's it like, what's going on? And he reported a 40% increase in application. Now, the reason why this is important is because these agencies get a budget annually. So they're staffed for last year's caseload, not this year's caseload, which means they have to do incredible things to effectively take in a 40% increase in applications. They have to really do some interesting strategies for that. Yes.
Sorry.
No, okay.
So is there a sense of the increase in demand, a product of increase in need or a product of increase in rule changes?
I think it's a mix of both.
Okay.
Yes, but I would say primarily driven by need, because again, we found that a lot of people weren't there. So it could be, there could be like some social network effects where someone's
Yeah.
saying, oh, I lost my job and I went up and it got snapped. It was really easy because you share
CARES was like pretty quick, right?
So they did.
The CARES Act was pretty quick, right? It was like in March, right?
And the cares were very.
Yeah, yeah, okay.
Presumably you can use WIC as a counterfactual.
Oh, no, wait.
Simple, oversimplifying, but it's more, you could anticipate change and growth more than you could SNAP and Medicaid.
More people worried about it.
Just the prerequisite requirements. Pregnancies didn't happen immediately and
Okay.
instantly change.
Oh,
right?
so you're thinking maybe there was a much increase in WIC, but.
It would be smoother in the transition,
Oh.
right? Because of eligibility.
Yes and no. So the only reason why I say maybe not, well, maybe I'm improving your point, because the coverage rate for WIC relative to SNAP is much lower. So SNAP's coverage rate.
It is generally.
80%, but WIC's coverage rate is about 50%, meaning 50% of folks that are eligible aren't on the program. So they're opting out of participating. So in that sense, we might expect there to be a higher increase in demand if there's job loss.
Yeah, I guess I was overly thinking of just the physical rather than the
Yeah.
sort of other elements of eligibility.
Yeah, there are a lot of people walking around that are eligible for WIC that are not on it and probably could benefit. This is a great program. It's my favorite program. Anyways, I'm not biased. But no, I do think it's important to think through a counterfactual policy case that would strengthen the insights of my piece. It's interesting. Now I'm gonna think about this. See, now I have something to consider. So unprecedented demand, role changes. So SNAP and Medicaid workers reported significant task and role changes to adapt to policy. And this is not inconsequential. Like I think even as public administration scholars or public policy scholars, we think about intake as, I should say, we read in policy manuals what intake constitutes. But we don't actually think about the process. Like keying in an application is different than recertifying someone. It's different, it takes a different amount of time and resources to do those things. And I'll show you that in a second. And then there were frequency, policy, and practice changes. So in SNAP and Medicaid in particular, workers reported rapid and often conflicting communication about policy changes. So back to that ambiguity piece and confusion about how to apply these new policy rules. And I think what's most important that I don't think we talk about a lot in the SNAP and Medicaid space is this continued pressure to perform. I think there's a lot of literature on what happened when caseworkers were tasked to meet TANF welfare role benchmarks. You know a lot about what happened in the TANF case. Let's push folks off. Let's make sure we meet these federal sort of benchmarks for caseload decline. We don't know what that looks like in the SNAP and Medicaid space. And the SNAP and Medicaid space, it's not about pushing people off the rolls, it's about processing applications quickly and accurately. And that comes with its own sort of issues that change the nature of citizen state interactions. So even though we have this unprecedented global pandemic and we have some major policy changes, there were no changes in federal performance benchmarks. So workers were still required to do what they've always done. There was not a lot of flexibility around that, and I asked and I asked and I asked. And surprisingly or not so surprisingly, even if there was federal movement, because I think towards when the American Rescue Plan came out, I think that there was more guidance that gave workers wiggle room. And there's certainly more guidance now as the public health emergency provisions are on their way out or phasing out. There was not initially. So workers were still feeling very pressured to be accurate and fast, despite having a 40% increase in applications, up to 40% increase in applications, and all of this sort of ambiguity and policy changes. Any questions? So here's a Medicaid recertification worker describing what happened at the beginning of the pandemic. In April, these are applications. They were triple what we normally would have. And still in September, our applications are significantly higher than what we would do on a normal basis. And then on the flip side of that, we're in September now. We've started on that recertification, and now we're doing the 6-month review of those April applications. So what it means is that recertifications have greatly increased. We're seeing bigger, we're almost doing more recertifications than we ever have. So this is pointing to the unprecedented demand. Once you get a whole bunch of applications, eventually down the line, you're gonna have a whole bunch of recertifications you have to do too. And again, today's agency staff is based on last year's numbers and budget. Here's a WIC worker that's describing their increase in applications. Well, numbers wise, this being the pandemic has gotten our numbers up. Our numbers across the state were kind of going down for the past few years, and they want us to see 97%. They want us to do 97% of our caseload. And our caseload is right around 13,000. So we just had hit 97% for the first time probably in 3 years before COVID happened. And now we're at about 114%. So they've experienced a sharp uptick in their caseload. They were struggling. I remember I told you that they're trying to troubleshoot why caseloads are going down, and they don't have that problem anymore. So caseloads are up, as this worker reports. So due to a pause in recertifications, so as part of the COVID level policy change policy waiver, the eligibility period for SNAP is no longer 6 months, it's a year. So due to a pause in recertifications and a high number of applicants, research workers shifted to working on applications because it became a all hands on deck endeavor. So here's a SNAP worker who is a recertification worker who is now tasked with processing applications. She says, I just want my life to go back to normal. The title of the paper. It's hectic, you know, because I'm used to recertifications, and they flip us over to applications. And although it's all the same program, the application versus the recertification, any verification that you ask, it's just different, you know, like recertification. If nothing changes, I don't have to ask for verification or anything versus an application. It's brand new. I need that verification. So you have to ask for everything. And it's kind of hard to flip back and forth. That's the difference, you know, of me being a research worker. I had to flip over and do something I hadn't done in years. And what she doesn't talk about here is the time. I mentioned time. So I always ask workers, how big is your caseload? How long does it take you to process an application? How long does it take you to process a recertification? An application, if it's like a decent sized household and people are employed, a straightforward case could take 3 hours. So 3 hours to process an application versus 45 minutes to do a recertification. So this worker, who's a pro at recertification, a veteran research worker, could do her 30 to 45 minute research pretty quickly. She knew what to ask for. Now she's got to do a 3-hour process and adapt to all of those changes. So what would take a seasoned application worker 3 hours to do likely took her much longer to do. Questions, comments? Oops,
Sorry.
yes.
And then with that, it's obviously not 3 hours face to face or
That's
online,
just keying in the application.
just physical. So would there be follow-up with
So
the client that might then
it's a good question.
increase dropout as well and coverage?
So, this goes to the administrative exclusion piece, so the practices that organizations do that end up excluding people. If you have a super complicated case, a worker is required to, request additional information. If elements of your case and what they have in a database, because they can confirm employment and residence and all that stuff in their own database, if those things don't match up, workers are required to ask for additional information, and the client has 10 days to give the worker that information. And then the worker then asks another, if the client doesn't do it, they do another request for an additional 10 days. So they give the client essentially 20 days to get this in. And that buys the worker time in terms of the federal benchmark for efficiency, because typically with a SNAP case, depending on the state and the county, you have between 20 to 25 days. Federal government requires it to be processed in 30 days. So it could be the case that you have a complicated case and you're doing all these additional requests for information because a lot of things changed in COVID in terms of household structure and employment, and that extends the time. So in the 3 hours, it could be, well, doggone it, they didn't send me what they were supposed to send me in the mail or via email. But it could also, and in a lot of cases, it really was just keying in the stuff, keying in what you need and verifying it through these other databases. It's a time consuming process.
Because you mentioned other databases, were there efforts to wrap around at all,
They're doing that now,
but
So,
not during this
not
period?
during. So there's a new initiative in North Carolina to do some data sharing and software building around the intersections of SNAP, WIC, and Medicaid. Sure.
You mentioned at the beginning that the COVID crisis, they relaxed some of the verification requirements.
I know, right?
So are they still verifying them just like the olden times, or are they stopping to verify, or how does that, or are they confused about whether they need to verify or not? Like, are the workers?
So there's a lot of confusion, which you'll see in a second.
Okay.
Like maybe you can see it now. So there's a lot of confusion on what to verify and how. There's also skepticism because these workers are monitored and graded on efficiency and accuracy. So they want to cover all their bases despite these relaxed rules. So workers are in many cases asking more of the client than they need to and doing more than what they're federally required based on sort of the practices of the organization and supervisor and director expectations.
That's interesting.
Now, this is just in North Carolina. You might find something different in Kentucky and Pennsylvania. Any other questions?
Would they get audited, and if they did something wrong, that they would get in trouble? Like,
Yeah, they
okay.
go under corrective action. Yeah, so, so I have another paper. It's called, It's Like Night and Day, How Bureaucratic Encounters Vary Across SNAP, WIC, and Medicaid. And the SNAP and Medicaid workers talk about the pressure. So from the beneficiary's perspective, they don't, or I should say, they report very positive, socially supportive interactions with their WIC workers, in part because WIC is incentivized to do that. By virtue of the way the program is funded, it's block granted and the money follows the caseload. So the bigger your caseload, the more money you get into the agency. So they really want to expand the caseload and retain people, which means they're nice. They're nice to clients. They're, calling clients in a warm, personalized way to woo them into their WIC appointments. With SNAP and Medicaid, it's about efficiency and accuracy. So you almost kind of want to deter complicated cases or strategically not answer emails and the phone, right? Especially if you're keying in for 3 hours, another application. So it's a different set of motivations, right? If you want your numbers to look good in SNAP and Medicaid, you might develop a different set of practices that end up undermining the quality of that citizen-state interaction. Yes.
But if WIC were not block granted, would we potentially reach more people? Or maybe not in the case of WIC because it's underutilized? But is it, so are you arguing, you're basically saying, right, there's a no, right, block granting, it's a little scary to me. It's like you just extolled the benefits of block granting, which I haven't heard right in a while, right? So which I know, so I understand your point, and it's really interesting, but so we shouldn't block grant SNAP.
10 employees. WIC is like the TANF Florida. So
Yeah.
So-
So, but block granting TANF made TANF go away, right?
it did,
But that's not happening with WIC.
because I think block granting made TANF go away. In part because people wanted TANF to go
Yeah.
away. And then also, the incentive structure for bureaucrats were such, we want to push people off.
Right.
So if you shift the incentive structure and the practices that come out of that incentive structure, you get a caseload expansion narrative. So I don't know, there's never been a time when, and I could be wrong, but in the past 20 years, I don't think there's been a time when the coverage rate for WIC has
Yeah.
been above 65%.
Yeah.
So there's never been full participation to where
Right.
someone might say,
It's not a
"Oh,
wait list.
but yeah, there's not a wait list, but there's never been close to full participation to where someone would say, oh, we gotta do something about this and cut costs, right?
But people want to block grant SNAP, for example. Like
They do because they
people
want,
who don't like SNAP want to block.
well, the coverage rate is 85%. So it might be the case that and I've always asked policy crowds this question, what's the ideal coverage rate? Do you want full participation? If you want full participation, policy rules are gonna look a little different. Even if you have even if you set benefits, sure, how you administer the program is gonna look different. If you want full participation. And we know this, right? So as it stands right now, WIC is a block grant, has created a set of incentives where they want to expand the caseload that are really nice to people in the process. And a part of it is, if you want to take a political science frame, the target population socially constructed in a positive light is babies.
Yeah.
So you're gonna deny babies milk, right? Babies and mothers that are trying to be better moms. That's how they're socially constructed. So it could be that's why we have this supportive interaction. But to date, aside from my work and a couple of others, the narrative is that most assistance programs are negative, like they're negative program experiences. There's not a ton of variation in what we're saying about assistance programs, especially since a lot of the literature comes from the TANF space. So in a sense, we're getting a sort of a picture of what it could be. You could have your worker be flexible with you and talk to you about your child and your life and engage in you in conversations beyond eligibility to boost caseloads. I think I'm a very long-winded person, so I actually think I asked you to answer questions you didn't ask.
No, it's good.
Any other questions? You had your hand up.
I was just wondering, and maybe you get to this, but again, working with unemployment insurance, there was a huge issue of fraud. And I was wondering if that was evident as something that these workers had to deal with, or was that not as prevalent in these programs?
They did not talk about fraud. Workers, I think state administrators care about fraud, federal policymakers care about fraud, but the folks that are actually delivering the programs, they care about meeting their numbers, getting a good score on their report card. Some of these workers are graded in that way. Some units have quality control where they're looking for fraudulent cases. I do think, and context matters, so in rural counties where people know folk, it gets a little tricky. They might say, oh, I know such and such has 2 more adults in that household that they're not reporting. And that might weigh in their discretion in how they choose to approach the case. But them, workers sort of articulating a concern about fraud is not something that I can do. Any other questions? Oh, so this supervisor is, she's talking through the frequent policy and practice changes that she's experienced in the course of the first few months of the pandemic. And this is a Medicaid supervisor. So in the beginning, when they were told not to touch cases at all, because remember, we have all these policy changes that expand certification, extend, I should say, recertification deadlines, don't have to do a lot of verification for these cases. They were told not to touch cases at all, and they didn't touch cases at all. But now they're saying, hey, you need to go back and touch it. So that has been that's made them a little frustrated because they're like, well, why didn't you just tell me to go ahead and work my cases in the beginning? Now I've got to work backwards. And touching a case means verifying all of this additional information. It means requesting the information that the client did report. It means verifying in the system. It means keying in an application in a different way than if you don't touch the case. It's a much more involved process. Here's a Medicaid worker. There's lots of changes that have happened as a matter of the most recent one just happened. These things change every day, That's compliance. So you have to really keep reading emails and rereading emails, because as soon as you get one, and you get another one saying, okay, well, disregard or don't disregard. This is the most updated change that this worker has to adapt to. And here's what I mentioned earlier about the report cards and the pressure to perform. So I think that this is it. This is the SNAP worker. So I ask about I ask folks to describe if they have any deadlines and what they have to do to perform well on the job. And this is a response. What aren't we graded on? Let's see. We're graded on everything from marital status. So whether or not you got the marital status right on the application for recertification. Things of that nature. Are the addresses correct? We're graded on income. If we counted it correctly. Where we got our income source from. We're graded on if the household is correct. If the child has the correct benefits. If the household matches other agency records. And this worker also shared that they're expected to score at least 95%. So their review sheets are pulled randomly by a quality control team or the supervisor, and they are graded on how accurate they have done the case and quickly they process the case. So we need to score 95%, having pretty accurate, which in some ways is a good thing, right? You want to make sure people are getting benefits that should be getting benefits. But in other ways, it puts a lot of pressure on workers, and it's hard, especially in these unprecedented times when you've got crazy things going on by way of policy changes and demand. I might be done. Oh, no. I know that has stressed a lot of coworkers out, this pressure to perform. And I know that a couple girls have left for that reason. If we don't do things correctly, but like I said, it's difficult to know what's correct when it's changing daily from COVID, and it's based on whatever that supervisor you said, whatever that supervisor you spoke to said. Policy changes, unprecedented demand, this continued pressure to perform. These are all the things that are going on in these agencies and how workers are experiencing these policy changes. I think I might actually. Key takeaway. Workers reported unprecedented demand and challenges adapting to extensive policy change, role changes, rapid changes, and the pressure to perform may have contributed to the administrative exclusion that folks experience. And I find that they experience in some other ways. The delays in administrative exclusion for those who are eligible. So the next step is thinking through what this means. Now, even though I traffic in jargon, I don't really like jargon, and I don't like parsing concepts and stretching them beyond what they can do or what they can explain. So the question that I have, is this about burden for bureaucrats, or is this a job demand resource challenge? Is this a different dimension of that? And how would I bridge those three literatures, essentially, the street-level bureaucracy literature, the job demand resource literature, and the administrative burden literature to explain what happened during the pandemic. And then moving towards, I'm actually meeting with my collaborator this week on analyzing the worker experiences in Kentucky and Pennsylvania with an eye towards variation in administrative structures. So Kentucky is a state level administrative delivery system. North Carolina is state-led county run, so there's a lot of county discretion in how these programs are rolled out. And Pennsylvania is a mix of two kinds of systems, decentralized and the use of nonprofits and WIC administration. So looking at the variation across these three states and how that might have impacted workers' experiences with these policy changes. And then the use of technology. So Pennsylvania has a common app that's online, and instead of calling into the office filling out an application is essentially like calling into the office. The workers are very responsive to the application. North Carolina does not have that. They're piloting something like that, but it's used marginally from the workers' perspective. So it'd be interesting to see how workers are using that common app in Pennsylvania. I guess I'll end there. We're just looking for how variation in all these different features changed or shaped the way workers adapted. Yes.
Burden for bureaucrats, how to balance street level bureaucrats and administrative burden literature. And I think there's a number of levels at which you can think about this. First of all, there's the burden of trying to do the best possible job for your clientele, i.e. citizens in need, right? But when I was listening to you, there's also the burden of making sure you hit the 95% bloody mark. And I mentioned to my colleague here that performance appraisal and performance measurement, much as I can appreciate elements of, it's gone. Elements of recording performance, it adds enormously to a burden. It has not much to do with the clientele necessarily, but it has to do with the supervisor wanting to get good numbers.
Yeah.
So that's a separate administrative burden. It's the burden of accountability internal to the organization, whereas there's also an accountability to a clientele they wish to serve because that's why they're in their job. You see what I mean?
Yeah, so some folks, the public administration walks in the room would say, public service motivation might be shaped by the pressure to perform so public service motivation.
Or the desire to perform.
The desire to perform and the pressure to perform a mix of both, and that might shape the quality of the encounter that folks have with applicants. So I do think it's a bunch of different dimensions. It's figuring out like which concept fits best. Maybe it doesn't, like that's the whole point of interpretive research, that it is entirely inductive and I should be doing this exercise of figuring out what I'm talking about. But also, being aware that there are these multiple paradigms to think through as competing explanations. Yes, sorry.
Thank you for your great looking presentations. Also related to that point about connecting street level bureaucracy research with administrative burdens and research. One of the central arguments in the administrative burdens literature is that administrative burdens are what they call constructive, which means that a lot of time administrative burdens are created by policymakers to advance some policy goal.
Yeah.
You see that story here. You think any of the findings that you just presented was
this was supposed to do the opposite. I think that's the issue. Like this was supposed to do the opposite. It was supposed to expand access. So the objective was to expand access, not prohibit access to these programs. So what policy making by other means, the means were good in this instance, and it's undermined by, I think, a short-sightedness in thinking through administrative capacity.
Maybe related to what Long says, keep in mind that it's possible that new policies added to already existing policy. And so the layering of policy over policy, Jennifer Palka wrote about it this year or last year, complicates matters for the SLPs.
Yeah, for sure. Yeah.
Amazing profile, thank you so much. Lot of So, I think one thing is, mentioned actually kind of strategy because you said that workers are shying away from complicated cases. So I actually studied the use of algorithmic decision-making to improve the benefits and disability determination. And one thing I found when it comes to disability determination, that algorithmic decision-making has a disparate impact on people with higher needs.
So they look for simple things too.
Yeah, one of the reasons I thought because the algorithms are good to cut the highest expenses due to budget limits. Like actually the position transcript show that the agency representatives want to cut the expenses so that when the algorithms are coded, they are cutting the highest expenses, which means people who need them the most are not getting. So, but I thought, in my research, this is, one byproduct of using automated decision-making systems in benefits eligibility determination, because it also restricts individualized consideration. So it has broad implication on reducing administrative discretion. So, which, from your research insight, I'm also thinking how technologies actually affecting public sector's work of the public work experience.
Yeah.
So that's one thing maybe expanded when you're our we can tap into see how public sector work is done because technology is triggering the relationship with the caseworker community.
Yeah.
And Ontario may be good in terms of the power dynamics because sometimes caseworkers discourage recipients from questioning and stuff. But at the same time, on the other hand, that severance of relationship reduces opportunities for recipients to get individualized relations. So really great research, and I'm looking forward to learning more.
So in some ways, the algorithm has its own set of discretion that's essentially doing what caseworker would have done anyway, which is look for less complicated cases that are not as expensive.
So, but you also said the individual caseworkers shy away from.
Yes, so the algorithm is doing the same
that's
thing, though.
interesting for me.
Yeah.
Because it didn't come up in my.
Oh, okay. I will say that, it depends on how the state uses technology. So in North Carolina, I mentioned that they're piloting this e-pass or this, online application, and workers don't like it because it's wrong. And then you see, yeah, like workers actually don't like it because of the information that, I think there's a specificity and a form of information that workers like that makes it easier to key in. And the kind of information that clients or applicants provide through these online portals, it's not specific enough. So in theory, you would eliminate the need for an interview, but workers find they have to go back and interview the client anyway, based on whatever they put in the system. And these civic tech companies that are interested in being the mediator, a lot of workers find that annoying too, like that you're giving them wrong information because what you think is required to process an application quickly and correctly isn't what the worker has a lot of institutional knowledge, I guess is what I'm saying, that some of these platforms and organizations do not. And they know what's going to get through, what's going to get processed in ways that these civic tech organizations and these apps do.
I think we're out of time. I'm gonna be later, so I can address my question.
I can wait, somebody else.
Go on ahead.
More minutes if there are other.
Yeah, I was just gonna ask if, so you mentioned public service innovation and whatever, we can set the terminology aside, but in talking to these folks, I know they have a lot of pressure about error rates and all these things, but did you have a sense, and maybe there's a lot of heterogeneity in this, but do you have a sense of if caseworkers want people to get the benefits? I know that's a weird
Context, it depends on the context. So I have a book project called It's Who You Know, something race in the rural South. I think it really does depend on context and the local political economy of the place. So some people end up, so for example, if you were, what's the biggest city in Ohio? Columbus. Oh, now I feel bad. Here in Columbus, your average case, well, I guess it depends, but it's a possibility that your average caseworker has a background in like some social science or something. And they probably wanted to help people. But you don't know if it's, the middle of nowhere, North Carolina or Ohio or wherever, North Carolina, because counties decide what are the training and education requirements for employment. So it could be that in a rural county, in Eastern North Carolina, that you only need a high school diploma. And the person that would have worked in the factory job that is since closed because of this restructuring of the economy is now the caseworker. But they're, interpreting complicated policy and they have their own priors about what it, as we talked about at lunch, what it means to be on welfare. So it depends on context and how people arrive at the agency. I ask bureaucrats to describe their professional journey, whether or not they went to school for this program, what led them to the program, whether or not they have a professional experience that would make sense as to why they would want to be a caseworker. So it's hard to give you out. Yes, it's not.
Yeah, it's interesting to think about factors that contribute.
One thing I will say, and I will die on this hill, and I'm glad that this is being recorded. I think we pay way too much attention to the level of benefits well, maybe not way too much. I think we pay enough attention to the level of benefits, but not enough attention to the administrative budgets of these programs. There are cost sharing agreements in SNAP and Medicaid. Where states are required to cover 50% of the administrative costs in these programs. What does that mean? If you are a well-resourced state, you're gonna have a great time getting on these programs. Maybe not the best time, but relatively speaking, a better time getting on these programs than if you're in a southern state that has a low tax base and it's difficult to raise funds to hire workers. We don't talk about that enough. We don't advocate for more generous cost sharing agreements. Well, the federal government is stepping in to ensure that people are getting on this program. So that's the one thing that I leave with you today. Sure. It was hard for workers, but it's hard for a reason. Because they did not provide administrative funds to meet the demands of that was brought about by this crisis, right? Of the demands of COVID. So advocating more for the federal government covering more of these administrative costs, I think would shift what we see in administrative burdens. Okay, next.
On your table if you want.
So can I look from questions?
All right.